my name is Dr. Ross Hauser. Welcome to the Caring Medical Florida facility. What you see behind me is an illustration showing the autonomic ganglion, and you can see that the autonomic ganglion are so close to the spinal column. Like, people don't realize, I mean, they lay right on the spinal column. So all the nerve cell bodies, that's kind of the brains of the nerves of the autonomic nervous system. That's the sympathetic nervous system and the parasympathetic nervous system. They run right along the anterior part of the spinal column. So when we have a face-down lifestyle and we get ligament laxity in our necks, the vertebrae move forward, and that can start blocking autonomic nervous system transmission. When a person is bending over all the time, or they're sitting all the time, it's the same thing happens in the back, where you start stretching out all the ligaments in the back. Then you get what's called anterolosthesis, or forward propulsion or forward displacement of the vertebrae. And one of the effects of this forward displacement or this spinal instability is it's going to start hurting the function of the autonomic nervous system. And the autonomic nervous system controls everything that happens in your body, especially the digestive tract, without you knowing it. It's called the voluntary nervous system. So symptoms like this: my stomach is bloated, I got an upset stomach, my kidneys aren't functioning good, my bladder isn't working, I got an irritable bladder. All these things can be just from instability of the spinal column interfering with the autonomic nervous system. When the autonomic nervous system is screwed up in the neck, you're going to get symptoms like brain fog, you can't focus, your vision isn't quite right, light bothers you, hearing's off, swallowing difficulties. Even the endocrine system, the adrenal gland, the thyroid gland, all the glands, the endocrine glands need proper autonomic nervous system input to function better. So think about that, all the people that are on thyroid medication, or they feel like they got adrenal fatigue. It could simply be because the autonomic nervous system isn't working quite right because of a structural problem, and that structural problem is spinal instability. The good news is it's totally reversible with changes in posture, exercises, and of course, when there's ligament laxity present, prolotherapy. Prolotherapy is very effective at restoring normal autonomic nervous system dysfunction.